Welcome to the Brewing Wellness Podcast, nourishing UFT members, one conversation at a time. Brewing Wellness is a podcast created by the UFT Member Assistance Program to support the mental health and well-being of our members. In order to do the work you do every day and be present for your loved ones, students, and patients, your cup has to be full. Brewing Wellness focuses on mental health and wellness topics that can help us all thrive in our professional and personal lives. We'll be releasing a new episode on the last Monday of each month. Remember to listen to the Brewing Wellness Podcast wherever you get your podcasts. And please, don't forget to subscribe. Now, let's get started.
Okay, so I'd like to welcome everyone to the Brewing Wellness Podcast. It's hosted by the UFT Members Assistance Program. So my name is Steven Solzer. I'm a licensed clinical social worker and clinical consultant with the UFT Members Assistance Program. And today I'm joined with Carleton Archer, who's the Vice President of Operations from the Vibrant Emotional Health. So just as an aside, so before we kind of got into the on-air status of the conversation, Carleton and I were kind of talking about a little bit about his journey and how he got to where he is. And one of the things that came up had to do with resources or lack of resources. And one of the things that came up for me as he was discussing his journey was some of the challenges that have found within the Members Assistance Program in the brief time that I've been here. And when I had heard about Vibrant coming on board, I was very excited because I felt that there was that missing piece to what we could provide membership. That, you know, we're kind of limited in what we can do, and oftentimes there are folks that really need more than what we can provide for them in that moment. So to have a resource that's available to them on those kind of off hours and those crisis moments is really been very positive and well received, both from staff and membership. So as the school year starts up, I mean, one of the things that we are thinking about always is how to best prepare our members for the stressors that they're going to be confronted with as they come into the new school year. So because of that, you know, we've teamed up with Carleton and the Vibrant team, which offers 24-hour, 7-day-a-week, 365-day-a-year mental health support services to our members. So we want to use today's episode to really kind of get into a little bit about what Vibrant does, how it can support the Members Assistance Program, and obviously the members associated. So with that being said, how's it going?
It's going great.
Okay.
Wish it was not such a rainy day for those of you not in New York City listening to this, but it's a pretty gloomy day.
Yes.
But I'm glad to be here and talking about this.
Okay, so we're going to spread sunshine today. That's our goal.
Absolutely.
All right. So I'm imagining that some of our members are just hearing about Vibrant for the first time today. So I thought maybe we could take a minute just to hear a little bit about what the UFT Vibrant line is all about.
Sure. Just to let people know, Vibrant Emotional Health is one of the nation's leading mental health organizations. We have been delivering high quality and accessible service and programming while also advocating for mental health awareness and education for 55 years now. We celebrated our 55-year anniversary in 2024.
Now, Carleton, let me ask you, have you been with them the whole 55 years?
I have not. I'm not even quite that old yet.
Okay, just check. Just want the audience to know. Okay.
Not too far.
All right.
But not quite
Fair
there
enough.
just yet. And so, you know, one of the accessible programs that has made this connection is our Here to Help Crisis Contact Center, which at Vibrant we affectionately call H2H. And there we are able to make connections to various community and crisis services to create a comprehensive support network.
So I just want to interject something that I did not know, but that you Vibrant has been involved with the UFT in different capacities, not just the start of this helpline that we've
No. We've been fortunate enough for many years to formerly be a tenant of the UFT at 50 Broadway, and then through that relationship, formed a relationship where we started one of our first lines, which was the Brave Line through UFT, the Brave Line for bullying, and we've been running that line for well over a decade now.
Okay, thank you. Okay, so there's a couple of other lines or resources that you have been involved with in developing. I see one of them is the 988 number. Can you talk a little bit about that and some of the other services that Vibrant has been part of?
Yeah, I mean, Vibrant has been involved in establishing, telehealth services and crisis and emotional support through telehealth for quite some time. Started with LifeNet, so it was 1-800-LifeNet here in the city, and that eventually evolved into NYC Well, and now with the creation of the new 988 national number is now NYC 988. And so we're very proud of how we've been innovators here in the city and then leading into the nation of providing telehealth, mental health, and crisis support.
Okay. So just to back up a minute, I just want to talk a little bit more about my role as a clinical consultant with the Members Assistance Program, specifically looking at and identifying how a lot of the members that we interact with are on the front lines. They're really kind of dealing with the day-to-day challenges of being an educator, administrator, support staff person, and really adjusting to what has been kind of like the post-pandemic environment, right? It's kind of coming from one extreme, going back into another, and really trying to navigate and figure out how to best deal with the stress and anxiety, interpersonal conflicts, and stress that really has come about all of this. And some of those issues that we see oftentimes have to do with the trauma, sometimes domestic violence kinds of issues, and really a need for crisis and substance use supports. So when I think about that in terms of resources, is that something that the Vibrant Mental Health Line can help our membership with?
Yeah, I mean, we're here to provide, first and foremost, be there for any crisis that may arise after hours. And, if there's an individual who doesn't know where to turn, we're hoping that they turn to this line where they're in their most need. But the other part of it is just providing just basic emotional support, right? And that can be whatever they need in the moment to help them kind of get through. If that's just having a voice on the other line who's anonymous, who doesn't know them, who won't, cast any judgments or anything like that, to just, be able to have a conversation with, then that's what we're there to do. If that's providing resources that you need in the moment and you really just can't find that resource that you need, we'll be there to do that too. Making connections to other things that, you can't really think of that's tied to the network and some of the resources that you provide and offer, we'll be able to make those connections as well. So it's just really kind of having that opportunity where you can pick up the phone, call somebody, and they're going to meet you where you are in the moment and provide you the best quality service in that moment.
So it sounds like, based on what you're describing, you have the adequate resources that can help our members.
Oh, yeah, absolutely. I mean, all of our crisis counselors are trained, and it's an extensive training. And, they make sure that through the training and role plays, live monitoring, that they're prepared to handle pretty much any situation that may come upon them. And one of those, skills that they're taught is motivational interviewing. And in that, okay, you're able to build trust. You're kind of able to meet somebody where they are in terms of kind of where their thinking is as they approach the call, and then hopefully, working with them so that they can feel in the moment that trust is built and will divulge more and more information that can only then help providing the adequate resources that we need, or if it's a crisis situation, providing de-escalation and stabilization in that moment until we can put together a safety plan or get emergency services activated.
So with that being said, one of the things that I have kind of been asked throughout the development of this relationship is, what are the differences, right? What are the differences between what services are available through the Vibrant line versus the Members Assistance Program? So I just want to kind of go through a few of them. And obviously, if there's anything that I'm missing, please, by all means, jump in. But one of the fundamental differences, and I think we talked about this earlier, is that this line is available 24/7, 365 days a year, right?
Correct.
So there's no holidays off. There's somebody who available all those times, right?
Somebody's available all the time, unless hand to God, if some catastrophic situation.
So why is this important? Because the Members Assistance Program, I mean, although our commitment to membership is obviously the same, our hours are limited, right? So we operate 10 to 6 Monday through Friday, and then in the summer, Monday through Thursday, 9 to 5. And we're closed various holidays and things like that. So the thing I think that's really important is really to understand and recognize that resources are available during those times that we're not. The other thing I think that's really important to differentiate is that there's a difference between what we do at the Members Assistance Program and what mental health support looks like through Vibrant, right? So for us, we do short-term counseling up to 5 sessions. It's typically more supportive counseling. And one of the things that I think is really important is, as a clinician, being able to utilize Vibrant as an adjunct kind of support is really an important tool and resource for us to have. So the idea of being able to work with somebody within those short-term counseling visits, and also having the Vibrant line available to them in the event that there's additional support needed, I think is really a win-win for the member. It's also immediate access, right? So is there any kind of wait time or a situation where somebody calls and they have to call back? I mean, how does that work?
No, I mean, we're staffed in a way where, we're trying to answer as many calls as we can within the shortest period of time. All right. And so the goal is to not have anybody wait, and to answer, every call we can. And to your point, right, all you can do is what you can do during the time frame that you have. But us being 24/7, 365, right, even within those 5 sessions, if somebody needed to reach out intermittently, right, they have this line as an additional resource to do so. And, the goal of what we're doing is not to supplant those 5 sessions or even long-term therapeutic care that somebody is seeking, but to provide brief, solution-focused telephonic care, meeting them where they are in that moment until they can get to a more long-term solution.
Okay, and that's important to know. And the other thing, just to add, the turnaround time for the Members Assistance Program is between 24 and 48 hours. So if somebody is in a situation where there's some level of urgency, the Vibrant line is something that could be really helpful in those moments as well.
Yeah, no, absolutely. And, they'll have access to that whenever they need it, whether they're home or at a friend's house or anywhere, they'll always have access to that line and that number once they get it. And an important part of this as running other lines is just making sure that people have awareness and that they know that it's there for them, right? And I think that's the biggest key is the more that this can be promoted from your end, the more we'll be able to help people as they call the line, because they'll have awareness and they'll know, anytime I need this, I can just pick up the phone and call this number.
And I think that's really important, just the idea of information. I think that the opportunity to have these resources really allows for a level of empowerment, right? So when people are in those kinds of situations, they're not first thinking about how and what do we do, but they already have laid out resources that are available. So with that, I just want to kind of emphasize that the MAP program, in addition to the Vibrant mental health support line, is continuing to offer short-term counseling. We have groups that run throughout the school year, and we've started some summer groups that we're getting a really positive response to, as well as different wellness series and workshops. So the idea of being able to collaborate with Vibrant has just been a tremendously helpful addition to the services that we're able to provide towards our members. So one thing I think that I've noticed with our members is that trust is a really essential part of the relationship. So one of the things that's really important for our members is a need to be able to trust the people that they're speaking to. So how can our members trust that the Vibrant counselors will understand them and be able to assist them in the best way possible? And I just want to kind of go back to something you had mentioned earlier, and that was you started to talk about motivational interviewing and this idea of meeting people where they're at. So can you talk a little bit about that and how the staff at Vibrant can basically convey or at least provide some level of understanding for members that are calling?
Yeah, absolutely. So, with, and the line is called UFT for You. And with that, right, there initially was a collaboration with the UFT and MAP. And part of that collaboration is kind of having some information on, what are some of the challenges that the members are going through? What are some, giving us guidance on, what issues you've been seeing before this line ever started. And then we took all that information and we put it into our training. So our counselors are specifically trained to meet the specific issues that your members have been dealing with. And we're having constant collaboration and conversations as new things come up, on the line that we may share, totally anonymous and in confidence, not divulging any demographic information or anybody's information, but saying these are specific issues that we are seeing. And as, we collaborate with you, different issues you are seeing. And it will continue to go back into our training because our training is always evolving and changing to meet the needs of, of the members in the moment. So, this is a constant implementation process. And as we continue to grow the line and continue to evolve, that's going to happen through collaboration and conversations with the UFT as well.
And that's an important point. I think that we should just really reiterate that this is a partnership, that this isn't just a standalone, okay, well, we have Vibrant in place, Vibrant will take care of you, and hands off on our end. It's really about collaboration. It's really about figuring out how we can utilize the information we're getting to help assist you, and obviously for you to do the same as you're learning about some of the membership needs and issues that are coming up, and for us to be able to develop and create different resources when and if possible.
So, Steve, I have a question for you.
Go ahead.
And so though we are a 24/7 hotline, I know that you all have such a large union, one of the largest in the country, and so many services for your members. And we at Vibrant want to make sure that when people are calling, they're calling for the right reasons, so that we can help them in the best way possible, like meeting them where they are. Are there any reasons where members shouldn't reach out to the hotline?
Yeah, so that's a good point. So let's clarify. So as you said, our union is very large, and we have a lot of different departments, and we assist with so many different things, and we just want to clarify and emphasize that specifically we are a mental health support line, specific to other areas that you might have, specific to grievances or medical issues, questions about your pension, workers' comp, licensure or certifications. Those issues can be directly addressed by calling the UFT call center at 212-331-6311. So that's one of the areas that individuals can receive assistance specific to those particular areas. So if any of these issues are causing you distress, however, Vibrant can help you manage the stress that comes along with these issues, as well as supports that could be provided from the Members Assistance Program, as well as the call center for logistical help. So, Carleton, I'm wondering, as we start wrapping up, is there anything else that you would want to add to our conversation that we might have not touched on today?
This is a new line, and it's going to be new for your members. And I would definitely, those who are listening, I would encourage them to reach out. And you can even reach out for your families, or because as we know, mental health challenges don't just affect individuals. It can be your family, it can be your friends, and sometimes you might just want to reach out in a way to kind of find ways that you can provide help, and we can provide that support as well, right? It's not just relegated to the individual as well, because we know, as stuff is happening to others around us and people that we care about, it can affect our mental health as well. So definitely encouraging members to do that. And just, because it is new, I would definitely encourage people to reach out and talk to one of our counselors if you're in need. And you can call 1-866-UFT-FORU.
So I want to thank you for that, and I just want to reiterate something that you were saying and really just kind of expound on it a little bit. There's so much stigma associated with mental health needs, and the idea that this line is available to family, to loved ones, not only about crisis, but really about support and trying to understand how to navigate those types of issues that come up, whether I'm being affected personally or a loved one is, I think is a really important and essential message that I hope people are going to get from today's podcast. So I want to just thank you for your helpful information. We're really excited to continue to grow this partnership. And for anybody who hasn't seen or heard of the helpline before, as Carleton had said, you could find out more or call them directly at 1-866-UFT-4U.
That's FOR.
It's FOR.
Yes, 24/7, 365. We're here for you to meet whatever need. We're excited to continue our partnership with UFT and looking forward to continue to grow and evolve this over the next several decades, hoping to maintain this long relationship. Thank you.
Sounds great. Thank you.
Once again, thank you for joining us for this episode of the Brewing Wellness Podcast, brought to you by the UFT Member Assistance Program to support the mental health and well-being of our members. If you are a UFT member, the Member Assistance Program can be reached at 212-701-9620 or by emailing mapinfo@uft.org. And once again, please don't forget to subscribe. Thanks for listening.